if we are serious about rebuilding the American middle class, if we are serious about reinvigorating American democracy, we need to develop a political movement which, once again, is prepared to take on and defeat a ruling class whose greed is destroying our nation.
Well, first of all, tell me, is there some society you know that doesn't run on greed? You think Russia doesn't run on greed? You think China doesn't run on greed? What is greed? Of course, none of us are greedy. It's only the other fellow who's greedy. The world runs on individuals pursuing their separate interests. The great achievements of civilization have not come from government bureaus.
Democratic socialism means that we must reform a political system which is corrupt, that we must create an economy that works for all, not just the very wealthy.
I'm glad to see one vote for the poor. The question is, how can we as people exercise our responsibility toward our fellow man most effectively? That's the problem. So far as poverty is concerned, there has never in history been a more effective machine for eliminating poverty than the free enterprise system and the free market. The period in which you had the greatest improvement in the lot of the ordinary man was a period of the 19th and early 20th century. Those of us in this room are the heirs of that. We benefited from the way in which our parents and our grandparents were able to come here. And by virtue of the freedom that was offered to them, were able to make a better life for themselves and them and us.
America proudly welcomes millions of lawful immigrants who enrich our society and contribute to our nation. But all Americans are hurt by uncontrolled, illegal migration. It strains public resources and drives down jobs and wages. Among those hardest hit are African Americans and Hispanic Americans.
The United States, as you know, before 1914 had completely free immigration. Anybody could get on a boat and come to these shores, and if he landed on Ellis Island, he was an immigrant. Was that a good thing or a bad thing? You will find hardly a soul who will say it was a bad thing. Almost everybody will say it was a good thing. But then I suppose I say to the same people, but now what about today? Do you think we should have free immigration? Oh no, they'll say, we couldn't possibly have free immigration today. Why, that would flood us with immigrants from India and God knows where. We'd be driven down to a bare subsistence level. What's the difference? If you have free immigration in the way in which we had it before 1914, everybody benefited. The people who were here benefited. The people who came benefited. Because nobody would come unless he or his family thought he would do better here than he would elsewhere. And the new immigrants provided additional resources, provided additional possibilities for the people already here. So everybody could mutually benefit.
Open borders?
Open
borders. That's a Koch brothers proposal. And it'd make everybody in America poor. Then you're doing away with the concept of a nation state. And I don't think there's any country in the world which believes in that. If you believe in a nation state, or in a country called the United States, or UK, or Denmark, or any other country, you have an obligation, in my view, to do everything we can to help poor people. What right-wing people in this country would love is an open border policy. Bring in all kinds of people who work for $2 or $3 an hour. That would be great for them. I don't believe in that. I think we have to raise wages in this country. I think we have to do everything that we can to create the millions of jobs.
Well, there's a sense in which that answer is right. There's a sense in which free immigration, in the same sense as we had it before 1914, is not possible today. Why not? Because it is one thing to have free immigration to jobs. It is another thing to have free immigration to welfare. And you cannot have both. If you have a welfare state, if you have a state in which every resident is promised certain minimum level of income or a minimum level of subsistence, regardless of whether he works or not, produces it or not, well then it really is an impossible thing.
We have got to raise the minimum wage to a living wage, and what we are here today to say is that living wage is $15 an hour. But we believe that in the United States of America, the wealthiest country in the history of the world, that if you work 40 hours a week or 50 hours a week, you should not be living in poverty.
The minimum wage has to go up. People are at least $10, but it has to go up.
Because the fact is that the programs that are labeled as being for the poor, for the needy, almost always have effects exactly the opposite of those which their well-intentioned sponsors intend them to have.
As an example, what are you referring to?
Let me give you a very simple example. Take the minimum wage law. The do-gooders believe that by passing a law saying that nobody shall get less than $2 an hour or $2.50 an hour or whatever the minimum wage is, you are helping poor people who need the money. You are doing nothing of the kind. What you are doing is to assure that people whose skills are not sufficient to justify that kind of a wage will be unemployed.
So I'm a strong advocate for Medicare for all. We are going to take on the healthcare industry, made $100 billion in profit last year, and that is the future, I believe, for healthcare in America. The average American will be paying substantially less for healthcare than he or she is. We're going to do away with all premiums. If you pay $1,000 a month, what do you call that? Is that a tax for the insurance companies? What would you call it? All right, I would call it a tax. That's gone. How much are you paying out of pocket? That's gone. How much are you paying for co-payments? Gone. How much are you paying for prescription drugs? Under Medicare for All, you won't pay more than $200 a year for all the prescription drugs you need. At the end of the day, of course, we're going to pay for it like every other major country out of the general tax base. Of course we will. Like we pay for military spending. It will be funded progressively. Upper income people will pay the bulk. I'm not going to tell you that average people will not pay more, but they will not be paying premiums, co-payments, out-of-pocket expenses. They will be spending less on health care than they currently do.
When the government is taking over any activity, there is more money available. But what typically happens is once the government has taken it over, the situation changes. There are no more votes to be gotten by taking it over some more. You have to move on to new fields and take over new areas in order to get some new votes. And the result of that is that those areas already taken over get starved. And instead of there being more resources available, there are fewer. In addition to the fact that the ultimate result of a government takeover is less resources, you invariably get lower quality and a lower quantity of medical care. I am going to cite from a study that was made by a British physician, Dr. Max Gammon, who spent 5 years studying the British Health Service. Mr. Gannon, in a rather amusing way, developed what he called a theory of bureaucratic displacement. He argued that whenever you have any organization taken over by a bureaucracy like a government, what tends to happen is that input goes up and output goes down. That useless work tends to displace useful work in a further extension of Parkinson's laws. And he illustrated it with hospital service in the United Kingdom. He took the 8-year period from 1965 to 1973. In that 8-year period, the hospital staff, the number of people, went up 28%. Incidentally, administrative and clerical help went up 41%. But what about output? What about what they were producing? Input was up. Well, he measured output by the average number of beds occupied daily. It turned out that the average number of beds occupied daily went down by 11%. And he hastened to go on to explain that the decline in the average number of beds occupied was not for want of patients, that at all times there was a waiting list in the neighborhood of 600,000 people waiting for hospital beds. Let me turn to Sweden. I quote from a report by Dr. Gunnar Bjork. In Minnesota, I should be able to pronounce a Swedish name, but it takes more than physical connection. He's a professor of medicine at the Karolinska Institute. He's a head of the Department of Medicine at a major hospital in Stockholm. He formerly was, and maybe still is, a physician to the King of Sweden. He gave a paper in 1976 at the University of Chicago on, quote, how to be a clinician in a socialist country. and I quote from his papers. It is obvious that the existence of a competing free market constitutes a continuous threat to the operation of a socialist public service, however heavily subsidized by taxpayers' money. The element of quality that derives from patients' personal preference for and confidence in certain doctors cannot easily be done away with so long as people are willing to pay for a free choice of physicians. To do away with such opportunities, therefore, has become a new goal of Swedish healthcare politicians. The introduction of these various regulatory processes has resulted in a cancerous growth in the numbers of medical administrators at all levels of incompetence. The Board of Welfare, I go on quoting, has recently issued a 60-page book trying to describe how to calculate the number of physicians needed to cover the necessary staff of any one clinical department. The book is a fascinating monument over the total absurdity into which legislators, administrators, and trade union representatives have finally brought a previously simple and efficient machinery. The setting in which medicine has been practiced during thousands of years has been one in which the patient has been the client and employer of the physician. Today, the state, in one manifestation or the other, claims to be the employer, and thus the one to prescribe the conditions under which the physician has to carry out his work. These conditions may not, and will eventually not, be restricted to working hours, salaries, and certified drugs. They may invade the whole territory of the patient-physician relationship. If the battle of today is not fought and not won, there will be no battle to fight tomorrow.